Hello again. I'm running for president, and this is part 4. Stopping the affordable cost of affordable health care, or ObamaCare, before we go bankrupt. The fourth item on my agenda, I'm for a catastrophic medical insurance bill, not the ObamaCare physically incompetent bill, and now in place before it bankrupts us. Obamacare costs 17% of the GDP, which is around $15 trillion, and that's more than $25,000 a year average cost to each of the 100 million wage earners, not just the taxpayers up to now. That's totally incompetent. But Obamacare sounds so good, after all, it's free, that the average voter will fall for it. Opinions are nice, but proof is required. Proponents of Obamacare don't want you to know that they cannot provide their promised utopia, and ignorance leads to a vote for them. Let's be specific. With known financial statements, though a couple of years out of date, that's the latest information available, and it hasn't changed much since then. Even Democrats admit that health care costs in the United States amount to at least 17% of the gross domestic product, and for a gross domestic product last reported in 2009 at $14.65 trillion, that's $2.49 trillion. Some $400 billion is collected from Medicare taxes, both from the retired and from those still working, but it leaves $2.1 trillion that must be collected from wage earners, not just taxpayers or asset holders, in some progressive fashion. At the end of this part is a table of progressive collections that must be made to cover the cost of Obamacare in addition to current and other future taxes. There's nothing in the Constitution that says government must be financially competent. It's the one error our forefathers made, and the one that our political factions are taking advantage of. Using the IRS data of wage earners by wage segments, we stepped the collections for Obamacare from an effective 2.5% at the income level of $11,000 to an effective 36% for wage earners earning a median $6.139 million. Now notice in this case that effective is it. There's no deductions. Note that the $400 billion collected from Medicare recipients is not listed here because the wage earners directly as Obamacare premiums because it is collected separately from the supposed retiring from working. The collections here represent either wage earner contributions, retired, insurance premiums, country contributions, or company penalties collected from wages or our company operating expenses. And they are in addition to those taxes already collected for government, wars, and any other benefits. This chart is based on having a tolerable average added cost to median taxpayers in the range of $34,000 annually. In other words, something they would be able to make the contributions but would serve the minimum effect on their households that could be tolerated. Okay, here's what to expect Obamacare will cost wage earners when it's fully instituted under those guidelines. Notice again we have on the left monthly cost per wage earner. You can pick your income and look at it. You can look at the median wage, and you can look at the percentage cost to the wage earners. Yeah, it starts at 2%, but it gets up to 4 or 5% pretty quick. And it gets up to 11, 12, and 27, and 30, and 36% before the end of the table. But in doing so, we will collect $2,150 billion. Deduct from that $40 billion for fraud, and add $400 billion for receipts from Medicare, and you have a total collected for Obamacare of $2.59 trillion. Now that's more than 2.49, but that's because the cost is 2.5 trillion because the 2013 and the 17% fraction is really now 2.55 trillion. And where does the income contribution fit? Think you can afford it? The average wage earner, not just the actual tax-paying ones, is about $32,000 a year, and that person pays $340 a month. Perhaps some is paid by their employer, But even then, some wage earners eventually pays for that through the employer's increased sales prices. Obamacare is not free. Why would you ever think increasing the number of recipients from 3 to 5 being covered by each wage earner would ever result in lower costs to that wage earner? Worse, can taxpayers, even expanded to wage earners, afford the Affordable Care Act? The numbers clearly indicate they cannot. Can Obamacare be paid for or merely borrowed more on our national debt? These numbers are the reason so many companies are opting out. They have good accountants. How about a column from the media on our accounting realities? Perhaps that media is so brain damaged from political correctness that they no longer are protecting us from politicians. And they're getting more like those in Germany in the last century's 30s. So what do I propose? I propose a catastrophic care bill to replace Obamacare that will shoulder the costs of individual medical expenses in excess of $250,000 a year, and with safeguards against abuse. Who knows? It might be similar to Medicare and graduated according to income. It will certainly lower the average medical insurance bill to subscribers. That means that more insurance companies can afford to provide medical insurance because they don't have to have that large reserve for those catastrophic bills. It's estimated that as much as $250 billion a year is paid for catastrophic medical care, both as Medicare and pre-Medicare patients. Spread over more than 100 million wage earners, that's a cost of nearly $2,500 a year, or a little more than $200 a month average. On a scale of payments graduated in income, like in my table, the average wage earner isn't likely to see a greater increase of more than $25 a month, and even they can afford that, especially if that means that Medicare and private health insurance premiums will be substantially reduced. Most taxpayers, most insurers have a healthy reserve for a catastrophic care allowance that will now be minimized, leaving much room for reductions in premiums. That can be assisted, of course, by limitations on the increases in medical costs. That's why it's my proposed national health care plan. And for those of us who are not real happy about ObamaCare in Massachusetts, that's RomneyCare. He had the approach of a company manager trying to provide for the company whole. And his plan covered perhaps a 20% increase in covered participants at a time when the medical industry was not so well paid. And that wasn't that onerous. Now Obamacare wants to have 100 million wage earners cover the medical costs of 325 million. So don't wonder why Obamacare is financially a failure. And the ones who think it's going to help them aren't educated enough to know it can't be done. If those promises were cars, we'd all have Cadillacs. Karl Marx just might be right about useful idiots. There's a reason why so many companies have gotten waivers from Obamacare. They have accountants, and we need them. If you disagree, again note my provision that you must do it with numbers, not opinions. If you can't show how Obamacare works, how much it costs, and how much is going to be collected, and who's going to pay it, when and how, sit down. You're just one of the useful idiots of Stalin, Marx, and Lenin.